Good morning. It's March 7th, and this is your daily brief in science. Here's everything you need to know. A recent study from University College London Hospital's NHS Foundation Trust has revealed promising results for patients experiencing long COVID-related loss of smell. The research indicates that functional septorhinoplasty, or FSRP, may significantly restore this crucial sense. This surgical procedure improves the nasal airway by about 30%, which enhances airflow and allows more odorants to reach the olfactory area, potentially helping to kickstart the recovery of smell. Led by Professor Peter Andrews, the study emphasizes that the sense of smell can be treated much like a muscle that strengthens with use. Increased airflow is vital in this recovery process. One notable participant, 27-year-old Penelope Newman from South London, reported a nearly normal return of her sense of smell post-surgery, which has allowed her to enjoy food and social interactions once again. Newman shared that her ability to appreciate food has notably improved, enabling her to cook with ingredients like garlic and onions and to dine out with friends and family. Before the surgery, she had come to terms with the possibility of permanently losing her sense of smell and taste, which severely limited her food choices and social life. Although she still experiences a slight reduction in her sense of smell, she expressed gratitude for regaining a sense of normalcy. The study highlights that approximately 6% of COVID-19 patients develop long COVID, leading to lasting symptoms such as loss of smell and taste, which can greatly affect their quality of life. Professor Andrews noted that many individuals continue to suffer from smell dysfunction 3 to 4 years post-infection, pointing to the urgent need for effective treatments. This research specifically targeted patients who had lost their sense of smell for over 2 years and had previously not benefited from other treatments, such as smell training or corticosteroids. Ongoing investigations are examining brain changes following FSRP to better understand the long-term benefits of this surgery for patients with smell dysfunction. The persistence of anosmia among long COVID patients underscores the critical need for further research and the development of new treatment options. A remarkable discovery has emerged from Western Australia, where researchers have identified the oldest known impact crater on Earth, dating back 3.5 billion years. This ancient crater, located in the North Pole Dome of the Pilbara region, was formed when a meteorite struck at speeds exceeding 36,000 kilometers per hour, resulting in a massive crater over 100 kilometers wide. This finding surpasses the previous record held by the Yarrabubba crater, which is 2.2 billion years old and measures 43 miles wide. Co-lead author Tim Johnson noted that the scarcity of ancient craters on Earth is largely attributed to erosion and geological processes over billions of years, rather than a lack of impacts. The discovery provides insights into a tumultuous period in Earth's history, when large impacts were frequent, particularly during the first 2 billion years of its existence. Co-author Chris Kirkland emphasized that such meteorite impacts could have significantly influenced Earth's history by creating hot water basins favorable for microbial life. The findings suggest that craters like this one may have created environments conducive to the origins of life on Earth. Published on March 6, 2025, in the journal Nature Communications, this research highlights the importance of understanding Earth's early geological history. The crater formed during the Archean Eon, a time when Earth was predominantly ocean-covered and undergoing significant geological changes. The immense energy from the impact may have played a critical role in shaping the Earth's crust, influencing tectonic processes and the formation of stable land masses that eventually became continents. Additionally, stromatolites found in the impact area, dating back nearly 3.5 billion years, provide some of the oldest evidence of life, offering clues about what fossilized signs of life on Mars might resemble. This discovery hints at the possibility of many other ancient craters yet to be uncovered, which could further illuminate Earth's impact history. Space agencies are preparing for a monumental mission to return Martian rock samples to Earth within the next decade. This ambitious endeavor raises significant concerns about the potential contamination by microbial life. The quest for extraterrestrial life has captivated humanity for centuries, and these missions aim to uncover signs of life by analyzing samples from Mars. To increase the likelihood of discovering biological material, space agencies are refining their detection methods for Mars sample return missions. A recent study published in the International Journal of Astrobiology highlights advancements in techniques for detecting ancient life. Researchers, including Associate Professor Yohei Suzuki, encountered challenges with conventional instruments that failed to identify microbial cells in 100-million-year-old basalt rock, prompting the development of a more sensitive technique. The innovative method, known as optical photothermal infrared spectroscopy, uses infrared light to analyze rock samples, allowing for imaging of structures as small as half a micrometer. Optical photothermal infrared has shown effectiveness in detecting microbial cells while preserving enough sample material for additional analysis, making it a promising tool for future Mars missions. Researchers from the University of Tokyo and NASA have successfully demonstrated this method on ancient Earth rocks, which share similarities with those found on Mars, and plan to apply it to 2-billion-year-old samples collected by the Perseverance rover. Concerns regarding extraterrestrial contamination are not new. Apollo astronauts underwent decontamination and quarantine procedures upon returning from the Moon. To mitigate contamination risks, the Committee on Space Research, or COSPAR, has established a safety assessment framework and protocols for handling Martian samples during their collection, transport, and analysis. The discovery of life on Mars would have profound implications, suggesting that life is not unique to Earth, while even lifeless samples could provide valuable insights into Mars's geological and climatic history. Looking ahead, Suzuki plans to test other rock types, such as carbonates, which are abundant on Mars and often associated with life, highlighting the exciting prospects in this research area. A recent study published in the journal Heart has uncovered a notable connection between common gynecological issues and an increased risk of cardiovascular disease. Analyzing data from over 3.2 million women across 28 studies, researchers found that women with conditions like polycystic ovary syndrome, or PCOS, and endometriosis face a 28% greater risk of composite cardiovascular disease. The findings are particularly concerning, revealing that women with these disorders have a 41% higher risk of ischemic heart disease and a 33% increased risk of cerebrovascular disease. Matthew Leonardi, one of the authors of the study, emphasized the importance of understanding the long-term health implications these gynecological conditions have on women's cardiovascular health and overall quality of life. PCOS affects approximately 5 to 6 million women in the U.S., characterized by hormonal imbalances impacting the ovaries, while endometriosis affects over 6.5 million women, leading to pelvic pain and fertility issues. Additionally, the study highlighted that over 10 million women in the U.S. suffer from heavy menstrual bleeding, which can lead to anemia, and that menstrual irregularities impact 14% to 25% of women of childbearing age. Cardiovascular disease remains the leading cause of death among women in the U.S., accounting for nearly 500,000 deaths annually, surpassing all cancers combined. The study also noted that women experience about 55,000 more strokes each year than men, making stroke the third leading cause of death for women. Interestingly, the increased cardiovascular risk associated with these gynecological conditions may manifest relatively early in life, highlighting the need for early intervention and monitoring. However, the researchers acknowledged limitations in their study, noting that many of the reviewed studies had a high risk of bias and did not comprehensively cover all aspects of cardiovascular disease, indicating a need for more high-quality research. The hormonal imbalances in PCOS and the abnormal tissue growth in endometriosis are believed to contribute to the heightened cardiovascular and cerebrovascular risks observed in affected women. This research underscores the critical need for healthcare providers to recognize and address the cardiovascular risks associated with gynecological disorders to improve women's health outcomes. Researchers have made a groundbreaking discovery about a protein called DSUP, produced by tardigrades, which plays a crucial role in protecting DNA from radiation damage. This finding could significantly enhance radiation therapy for cancer patients, as tardigrades are known for their remarkable resilience, surviving radiation doses over 1,000 times greater than what is lethal for humans. Scientists are now delving into the unique biological mechanisms that allow these microscopic creatures to withstand such extreme conditions. The evolutionary adaptations of tardigrades enable them to utilize D-soup to bind to DNA strands, effectively preventing damage from radiation exposure. A collaborative team from MIT, Brigham and Women's Hospital, and the University of Iowa has developed a method to deliver D-soup messenger RNA, or mRNA, encapsulated in nanoparticles to murine cells. By combining polymer and lipid components, researchers successfully optimized the delivery of mRNA, demonstrating protein expression post-injection. The findings of this research were published in Nature Biomedical Engineering on February 25, 2025, emphasizing the potential of D-soup in cancer treatment. Subsequent experiments confirmed that nanoparticles carrying D-soup provided significant protection to oral and colonic cells from radiation damage, as indicated by reduced double-stranded DNA damage markers. Importantly, the mRNA therapy did not impede the radiation's ability to kill cancer cells in mice with oral cancer, suggesting broad applications for protecting healthy tissue from DNA damage. In trials with mice, the injection of D-soup mRNA resulted in significant reductions in radiation-induced DNA damage without affecting tumor growth. Healthy mice treated with D-soup also exhibited decreased double-stranded DNA damage after radiation exposure, with no significant systemic effects observed. If successful, this innovative research could benefit the 50 to 60% of cancer patients undergoing radiation therapy, and may also provide protection for astronauts from space radiation. Plans are underway to develop an improved version of D-soup that minimizes immune system reactions, and researchers are exploring other radiation-resistant tardigrade species for further insights. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.